plan to welcome new medical students in just 2 years. Good evening. Thanks for joining us. I'm Nadine Woodward. Today, Washington State University unveiled its timeline for opening the state's second medical school. Last month, Governor Jay Inslee cleared the way when he signed House Bill 1559 into law. The legislation eliminated an almost century-old restriction that gave the University of Washington exclusive rights to a medical school in the state. And now begins the accreditation process to get those students on campus. KXLY4's Allie Norton joins us there now live. And Allie, there have been several things that have to happen. Most importantly, getting money to pay for it is a big one.
Yeah, and Nadine, how much funding they get depends on which budget the state legislature agrees to. The school also needs a founding dean, so the search for leadership and funds both well underway, which is welcome news to those who say we need more doctors in the area now.
Emma Noyes knows all too well what it's like to need medical attention and not get it. Growing up in Omak, she says there was a local clinic, but it wasn't fully staffed.
There's many people who have to travel great distance to see any kind of specialist.
Noyes' job at WSU is to recruit tribal high school students into the health sciences to fill that void. And with the addition of the new medical school, now there's more opportunity.
Our rural areas are really high-need areas in terms of many medical professionals.
She is one of 11 who was asked to help find the founding dean for WSU Spokane's medical school, part of President Elson Floyd and Chancellor Lisa Brown's timeline for opening the medical school. The accreditation process is already underway. They hope to admit the first class of 40 in 2017, then gradually add more students until they have full accreditation.
Our timeline is ambitious but doable.
It's costly too. The accreditation process alone costs $2.5 million. Proposed budgets in both the House and Senate allocate that money. The House adds an additional $4.25 million for providing the education. The ultimate goal is to have 120 medical students a year, with the hope that some of the students will be from rural areas, so they go back to those areas to practice. A plan that Noyes says will need an exceptional dean.
I'm really excited to be able to be a part of looking at the leadership for medical school that will be focused on partnering with those areas.
And now, as for the WWAMI program, President Elson Floyd says he assured that he is dedicated on his end, or on WSU Spokane's end, to keeping the WWAMI program here in Spokane. However, he adds that the University of Washington is contacting other universities. So as of now, that is up in the air. Reporting live tonight, I'm Allie Norton, KXLY4 News.